Welcome to Alcare Dental's YouTube channel. I'm your host, Dr. NG. Today we're going to talk about root canal. What a root canal is, basically a lot of patients are actually always afraid of coming in to do a root canal, but I always tell them once you're frozen and you're not infected, guess what? It's just like a filling, but it takes longer. We would like to actually always see the patient before this stage. When it comes to this stage, patients are usually in a lot of pain. And patients are actually very tender, sometimes swollen. You can actually even get a fever from it. At that stage, a lot of patients don't realize you can actually die from an infection of the tooth. For example, if you have an infection on your toe, you get the rest of your body to actually fight that off first. But infection here is awfully close to the brain. So it can actually get into quite a bit of trouble if you let infection brew inside your mouth, and actually a lot of people have died because of it. So when you guys have pain, swelling, fever, always come in and see your dentist right away to see what we can do to try to save the tooth. So root canal is you basically take all of the infected tissue from inside the root, which is where the canal is. That's where all the nerves and blood vessels are. And when they're infected, we need to actually clean everything out. Root canal actually works really well if it's done correctly. So what they do is we rinse it out as a chemical reaction that we actually rinse out all the infected tissue, and then we actually fill the canal itself with a material called gutta percha, which is actually made from a rubber tip. So it's actually very inert. There's actually a lot of people out there that actually say that root canal is not good for you and it causes all these issues. But in my opinion, that rubber tip stays in there. It doesn't do anything to you. It's just a filler material that I actually put inside the root itself, so it never comes out. And then we actually do a crown on top of the tooth afterwards to protect it. Because why we do a crown is because after a root canal, the tooth is very brittle because it doesn't actually have any more nutrients going to it, so it actually dies because it's already dead or because of the infection. So that we actually have to have a helmet for the tooth to actually make it nice and strong for it. So if you're experiencing pain around your jaw or swelling or even fever, it may not be a simple thing as cold. So there's a lot of things that can be happening to you. It can be very serious, especially the swelling, or even if you find a little pimple inside your jaw that looks like a little pimple with a pus in it. So it could get really serious and you can end up really sick or even death. So please give us a call, book in ASAP so we can take a look at you. Thank you for watching today. Please subscribe to our YouTube channel.